afternoon, everyone. I am Jaira May and Agorin, your nurse for today. So for today, I'm going to assess the administration of cytotoxic drug. So of course, for the assessment, number one, you need to assess for patient's overall condition, which included the height, weight, and the presence of dehydration, anxiety, dizziness, and nausea and vomiting, to determine the appropriate dosage of the drug plan for appropriate nursing management. So number two, check if there is a bad flow of blood in the IV line site, if the IV site is free from pain, redness, and swelling, the cannula is not dislodged, and to ensure the IV line is patent and ready to the treatment. And now, for the planning, of course, number one, you need to check the prescription is written clearly and unambiguous. If necessary, clarify the prescribing doctor to observe the 10 rights of patient drug administration. Number two, you need to check that the doctor has reviewed the full blood count, urea, electrolytes, creatinine, clearance, and other laboratory tasks to ascertain whether the client is fit for the treatment. And then, after that, you need to check if the patient has signed consent form. This is done to respect the right of the client in making of appropriate decision for his health after receiving an extensive discussion of the treatment regimen. So, of course, number four, you need to check out that the appropriate antiemetics have been prescribed and administered to ensure that all medical interventions are ordered by the attending physician and that flow of the procedure follows the institutions of guidelines. This is also the continuation of the planning. So, when the protocols contain the pre-medication of hydration, ensure that this area prescribed and given according to the protocol, to ensure that all medical interventions area ordered by the attending physician and the flow of procedure follows institutions guidelines. And then number two, you need to check whether the drug to be administered include vesicants PR, non-vesicants. Never administer a cytotoxic drug without knowing the information. To determine the appropriate interventions and consideration, especially when administering vesicant drug, of course, check for the following: the date of administration, the name of the drug and infusion fluid, the prescribed volume and infusion fluid, and the name of the patient, to observe the 10 site of patient in drug administration. Still, for the planning, gather all the equipment and supplies needed for the procedure. 0.9 NaCl, syringe and needles, personal protective equipment, glove, mask, goggles, antiemetic drug, alcohol swab, IV pole stand, IV administration set, and also IV cannula, IV tray with the prepared cytotoxic drug, and the sterile gauze. And now, let's proceed for the implementation. Number one, I need to wash my hand. It deters the spread of microorganisms. And number two, don personal protective equipment, which is PPE, to protect the nurse from the cytotoxic drug. So, for the during the cytotoxic bolus infection, number three, remove the chemotherapeutic drug from the bag, place in fill container to protect drug frontline exposure where may affect its potency. Number two, you need to flush the IV line with normal saline to protect for the patency of the IV line and to determine whether the vein will accommodate the extra fluid flow and irritants drugs. Accommodate the extra fluid forward to imitant drug. So, for the administering cytotoxic drug by the bolus infection, number one, you need to infuse the compatible flush to IV access to promote continuous flow of the drug and to avoid irritation during the administration. Number two, you need to ensure that the infusion of compatible fluid is fast running. Number 3, using the non-touch technique, swab access devices to avoid contamination of cell from the drug. And then you need to place the gauze under the side port and swab with the chlorhexidine alcohol swab to reduce the number of pathogens introduced by the needle at the time of insertion. And then number 5, we need to connect the syringe with the drug to the access port using hinge to prevent the leakage or separation which may occur due to pressure during administration resulting in spray and contamination. And then number 6, administer the drug into the fast-running infusion using a steady positive technique. And then to promote continuous flow of the drug and also to avoid irritation during administration. And then number 7, once of the bolus has been administered, flush with the compatible flushing solution to prevent the drug interaction, to prevent leakage of drug from the puncture site on removal of the device. So for administering cytotoxic drug by continuous infusion, number 1, you need to remove of the administering set to expose the injection site on the container. And then number 2, you need to spike the IV set to the IV fluid bottle and prime the IV line with normal saline or compatible fluid to check the patency of the IV line and to determine whether the vein will accommodate the extra fluid flow and the irritant drugs. And then number 3, you need to use the non-touch technique swab the access devices to reduce the risk of contamination. And then spike the IV set, the bottle with chemotherapeutic agent, then place the label, keeping within the foil container to avoid exposure of the drug to the light which may affect potency. And then for the number 5, you need to regulate the rate of IV fluid with the chemotherapeutic agent as prescribed to continue the delivery of therapy at the prescribed rate. For the administered cytotoxic drug by continuous infusion, number 1, you need to check the blood return at regulate intervals throughout administration, monitor the size of redness, swelling, and or leakage, encourage the patient to report any signs of discomfort. If extra conversation is suspected, stop immediately and allow guidelines for extra. So to avoid the possible complications such as extravasation, phlebitis, and infiltration. And then number 2, you need to dispose all the waste as per guidelines to ensure safe disposal of and avoid injury to the staff and prevent reuse of equipment. For the evaluation, of course, you need to ensure that the therapy prescription has been signed with written is unapplicable to go. So I'm just going to assess the cytotoxic drug. So disclaimer, I'm here in our province, so not every medical equipment are available, so I just improvise. So of course, number 1, the IV fluid, and then I'm just going to put it in here, and then I'm just going to check the leakage, the redness, and the I'm going to insert this one to the patient. And then I'm also going to put it to chemotherapeutic agent. So it is all inserted or in the patient.